So I wanted to welcome everyone to our session here today around returning to the workplace. I wanted to just briefly do some introductions and start with myself. So my name's James Barr. I'm a partner in KPMG's advisory services practice in Regina, and I'm going to be our MC for today. I was happy when Ahmad reached out to me from the association, because he had seen KPMG's publication on return to work and asked if we could do this. I was quite happy that we could do it for your organization, and also happy to have Stavros Dimitrou join us as our main presenter today. I'll let Stavros introduce himself a little bit more fully when he gets started, but he's a partner in our People and Change practice, and he's delivered this similar presentation to a number of organizations. So you're in good hands, and also quite happy to have with us today, representing the province of Saskatchewan, Kirk Westgard. Kirk's the Assistant Deputy Minister for the Ministry of Trade and Export Development, and he's been working on the recovery effort for the province for a while now. So he's quite happy for him to join us to give us a little bit of some insight into some of the specific rules and questions that you might have. So before I went too far, I just wanted to check in. Ahmad, you set this up. Was there kind of any introductory comments that you'd like to make to the team, or would you like us to just proceed?
We'd just like to take this opportunity to really thank, yourselves and who you were able to gather for this presentation, and as well as just thank everyone from the sector. I think this is a great opportunity where we're able to come together, ask any perhaps common questions, and just try and get a better understanding and move through this uncertain period. So really just thank you to everyone who showed up, and of course our presenters, and I'm excited to see what comes. So thank you.
Great. So just in terms of some housekeeping and logistics for our session today, I've got my webcam on now. When Stavros starts, I'm going to turn it off just to control our bandwidth for everyone here. Teams is usually pretty stable, but just to make sure everyone gets a good experience. I would ask that people use the text chat for any questions that you might have. We're probably going to be administering questions at the end, but if there's anything that's particularly relevant to the section that's being spoken on, then I'll try and grab Stavros's attention to address them. And at the end, we can open up the mics to let people ask some live questions as well. We're trying to leave about half an hour to address your questions. So I ask if people keep on mute if you're not speaking, just to manage the background noise. And just was going to mention that Kirk is here to help us answer some questions around things like public policy or guidelines or some of the health requirements, because he's a little bit closer to that than we are, but he's not going to have an actual presenting piece today. So we'll hear from him with his questions to answer. So with that, Stavros, over to you. So now you have to unmute Stavros. Stavros, we can't hear from you. I can see you're still on. We saw your smiling face a few minutes ago.
James, can you hear me now?
Yes, here we go.
Apologies for that. I'm not sure what happened. I think I have 2-3 layers of mute that I have to get through because I'm wearing the headset as well. So I just said thank you, James, and hello, everyone. Before I start, I just wanted to confirm again that you can see the presentation slides. James, can you see the slides?
Yes, we're set up. Yep.
Okay, good. If at any point in time you have trouble seeing or hearing, please let me know verbally, because I don't have access to the messaging section of Teams right now as I'm presenting, so I wouldn't be able to see any comments you may have, right? So just let me know, just shout out. So my name is Stavros Dimitriou. I'm a partner with our management consulting practice. I'm based in the prairies as well. I'm actually out of Calgary. I have 20 years of Canadian and international experience helping organizations from different industries with their workforce and human resource challenges. Yeah, I'm very happy to be here with you today to walk you through our KPMG Return to the Workplace guide. You will notice that we explicitly have called this workplace and not work, as most of us have already been working, and in some cases even more than before through this pandemic. So we felt that that's a more appropriate term. Of course, a lot of organizations have been, especially the ones offering essential services, have never stopped working like from their sites. This guide is primarily for individuals working in the head office or in an office location, rather than those essential services groups working on site. And the reason we've put this framework in place is to help organizations understand what they need to consider when they're bringing people back to their workplace, and to help them put a solid plan in place or to review and sustain the plan that they already have. From what we're seeing and from what we're hearing, a number of organizations have already started bringing employees back, and of course I'd like to hear from Kirk and from the others on the call in terms of what you're seeing and what you're hearing. But many organizations have already started doing so. Others are actively considering it or planning for it. The numbers overall across the country are still relatively low, and they vary by industry and location. So again, interested to hear from your end what you're kind of seeing around that. What we're going to do today, walk you through some of the challenges that our organizations have been facing as well in terms of the return to the workplace efforts. And I would like to make this as much as we can an interactive session. We're going to have time in the end for questions, but if at any point in time throughout my presentation there's something critical that you would like to address, please type it in the messaging box, and James will be looking out for that, and can stop me, or we can address some of those questions in the end. So I think, James, you've already covered these. James and myself plus Kirk will be your main presenters for today. And if there is no upfront questions, I'm going to dive straight into it. Okay, seems like there's no questions. So in terms of, as a starting point, I wanted to highlight a few guiding principles and assumptions that we have been taking in terms of the return to the workplace, and we believe some of these. Yeah, hello.
Your slides are not advancing.
They're not? Okay. Let me try one more time. Apologies for this. Can you see them advancing now?
I can see the presenter view. There we are.
Okay.
Okay, they're on the principal slide now, yeah.
Okay, great. So I was saying we believe some of these guiding principles and assumptions are universal, so they should apply across the country. But again, interested to hear from you and from Kirk to see if any of these are different in Saskatchewan. So in terms of the guiding principles, the primary guiding principle is that the health, safety, and well-being of employees and of visitors to those workplaces is the top priority. And what we're seeing in terms of these plans being put together by organizations, this is not a one-man or one-department show. Usually there is representation on those task forces from a number of groups. This could include the human resources team, it could include health and safety, it could include legal, quality, risk management. So it's a joint effort by a number of different groups. One leading practice that we've seen as well is organizations have been connecting, with medical professionals just to get their view in terms of the plan and whether that makes sense, and also to confirm whether some of the measures that they have been taking to prevent the spread of the disease within the workplace are aligned with the guidelines and then the rules set out by the government and the health authorities. In terms of the assumptions that we're making, one big assumption I would say is that this threat of the pandemic will not go away until there is a vaccine or effective treatments in place. Of course, that shouldn't stop us returning to the workplace and kicking back, the efforts to restart the economy. However, the threat will remain here until there is a vaccine or an effective treatment. So we're gonna need to live with this, learn how to live with this, for at least that period of time, and it could be up to a year or more, until that's in place. And another important consideration and assumption here is that when you're putting these plans in place, you should definitely, as a first priority, look at what the governments have to say, both at the national, provincial, local levels, because they would issue those guidelines and regulations, and obviously you need to follow their guidance before establishing any plans to return to the workplace. So that's very important that you follow those guidelines. If at any moment in time, if there are any big questions, again, as I said, please interject. Otherwise, I will keep going. And I wanted to share the phases of the pandemic, of the crisis. So we see this pandemic as having four main phases. The first one, the reaction phase, was obviously when this first all started, and we all, or most of us, had to learn to work remotely practically overnight. And that led to the resilience phase, which overall was pretty good. Organizations, for the most part, were able to prove their resiliency and to continue their operations, working to a large degree remotely. And but of course, that was always meant to be, a temporary phase. The recovery phase is when we started seeing organizations and individuals returning to the workplace, and this is the phase that we're currently in. And a number of more organizations, will go through that phase, I would say, over the remainder of the summer and into the fall, some even later, depending on the nature of their business. And then the new reality phase is also a very critical phase, because there have been a number of very bad things coming along with the pandemic. There have been a number of calamities. However, it is also an opportunity to look at our organization, to look at our digital systems, to look at our workforce, and to determine what do we want that new reality to be. So there is a saying around never let a crisis go to waste. This is what we mean by the new reality. So what can you learn from this crisis, and what changes will you need to make to your workplace, first of all, like to the physical workplace, to your processes, and then to your workforce in terms of allowing them potentially to work remotely or from home for an indefinite period of time, or some of them, obviously not all of them. So that's the new reality. Understanding that will be pretty key. And it's going to help organizations differentiate themselves, especially around talent, because we know that talent for a long time has been asking for flexibility, especially people with young families. So now this has been forced on many people, but how can we take the good out of this and potentially implement them on a more longer term basis? In terms of the importance of returning to work, there is an element that links this return to the workplace to the recovery of the economy and to public confidence. And the reason why I think it's obvious for many people, but I'm going to try and explain it. When we had the pandemic, obviously, and many organizations had to either stop or scale back on their operations and people working from home, that had an impact on public confidence, that had an impact on the economy. Now, with organizations and individuals returning to the workplace, obviously that helps increase that public confidence again, and hopefully that will lead to an economic recovery as well. So that's the link, and that's why it's important, even if we can figure out how to work remotely. I mean, that we cannot all do that all the time. I think like the interaction component is pretty important anyway, but there is a link to it, to public confidence and economic recovery as well. In terms of making the decision around which sites to reopen and who to bring back and when, there's a number of things that organizations have been looking at and considering. The first one is the risk level of the community itself. So within the community, and the community obviously is, it's like the onion layers, right? You look at the province, then you look at you will look at the city you're living in or operating in, and then even within that, you can go further down into specific communities. But within those communities, what's the risk level? If it's a very high risk level, can you put together the mitigation measures in place to ensure that you can manage this community risk effectively? If not, then maybe you should readjust the timing component of returning back to work. The facility risk is another component here. And this includes things like the building itself, the air quality within the building, whether this building is set up to allow for the social distancing that may be required, how closely together are the seating arrangements, and whether there is like touchless light fixtures and those sort of things. So again, that's another consideration that you need to have in mind. In terms of, and though both of those are, non-workforce related factors. From the workforce perspective, which I think is a pretty key component here as well, there's a number of things that you need to look at. The first one is whether that particular job can be done remotely or not. And when I say job, it could be a role, but it could be the function, all together. Then for that job or function, again, maybe it can be done, remotely. However, is there a high need for in-person interactions or not? And if there is, obviously, you should take that into consideration when you're making your plans. Then within your different employee groups, you have to determine and identify who could be at higher risk compared to others, maybe because of, demographic or other underlying conditions. And again, in terms of the definition of who's at risk, you should follow the government guidelines around that, because they could vary by location. but it is important to be able to differentiate individuals and groups that may be at higher risk. And then last but not least, it's very important to talk to your employees. What we're seeing organizations do is issue surveys for their employees, just to understand how they are feeling about returning back to the workplace. And again, we're not suggesting here that if employees don't want to return back, that you shouldn't return back. However, it is an important component, right? And maybe if you make it optional, we've seen organizations making this optional for their people. If you do make it optional and then nobody wants to return back, in some cases we've seen as high as 70% of people for organizations not wanting to return back, at least right now during this time, then you have to weigh the benefits of getting people back and having them work from the office. Do they outweigh the costs of running that facility? And in some cases, if they don't, then again, maybe you need to rethink the timing for returning your employees back to the workplace. Just gonna pause there and see if there's any thoughts so far, or are we good?
Nothing's come through the text chat yet, Stavros. I'll keep watching it.
Okay. And James and Kirk as well, if you guys want to offer any thoughts as well as we go along, please feel free to do so. And maybe Kirk, once I go through this next slide, I might ask for your thoughts as well around what you're seeing in your province. So in terms of who's returning to the workplace, these are some of the insights and findings that we've seen nationally. And again, these could be different in different provinces, in different locations. So I am interested to see what you're seeing in Saskatchewan and whether these insights are consistent there, or maybe they're different. So in terms of the volume of people returning, what we're hearing is that this varies again, but it could be between 10 to 25% of the workforce between July and September. And the type of positions that are being prioritized are, the ones that need primarily those interactions. So this includes real-time operations and technology support, where you have to be like in the office to support people. Middle office and back office functions where they may still be paper-based, so they don't have the ability to work as effectively remotely. Customer services, especially when there is, again, the need for in-person interaction. Regulated roles where they handle sensitive data, and again, they cannot do their job with the same sensitivity from home, and as well as senior leaders and team leaders. We've seen in many cases, those individuals have taken the lead and be the first ones to go back to the office. And in terms of some of the challenges that we're seeing across the country, commute is a big one. Obviously with some of the physical distancing requirements in some jurisdictions, the transit times are taking longer just because they don't allow as many people, for example, on the buses or trains if they exist. So that means that the commute time, is longer. The family obligations is a big one that we're hearing around childcare. Obviously, with schools, now they have been closed anyway, but with schools not working like from site, many families have been challenged in terms of taking care of their kids. So that has been a big one. And we're seeing some good practices there from some organizations. For example, one company and one technology company that I've talked with, they were looking to hire a teacher so that they can take care of the kids while their parents are working. So there's things like that, or daycare facilities. There's things like that companies are doing or looking to do that may help alleviate this challenge. And then obviously the workforce scheduling restrictions, especially when there is collective bargaining in place, has been another challenge. So just gonna pause there and see, Kirk, first, if you had any thoughts around whether these, apply in Saskatchewan as well, whether you're seeing some different things there.
Thanks, Stavros, and thanks, James, for letting me be part of this. We are seeing a little bit difference, and I've had the opportunity to talk to businesses over the last couple of months about returning to work and how Saskatchewan is going about the reopen plan. What I can say is the information that I've been presented, and some of it's anecdotal and some of it's through key partners like the CFIB or the Regina Chamber, which I've worked quite closely with over this time, to say like 71% of Saskatchewan small businesses are open. Now, with that being said, that doesn't mean they're fully staffed. And you brought up a very good point that just because you're open doesn't mean you're at 1, full staffing levels, 2, staff want to come back, and 3, that the demand is back out there yet and there's comfort. And I think as you go through the phases in this pandemic and go from recovery back to the growth phase, that we'll see that more and more people are going out there and are continually venturing outside of their home. I don't think we're totally out of the recovery phase yet, but I think we're well on our way. And what we're seeing is that people are starting to go out. And we have to let people know what we've done in Saskatchewan is we put the guidelines out there to be safe, to let people know that it is safe to go out as long as you follow the guidelines that are put out. And yes, they are very general guidelines. There's both some for the public as well as for the employee safety. But yeah, I think we're a little ahead of the curve in Canada of reopening, and we're seeing more and more people go back to the office. On the other hand, government is almost fully back. I can say that government should be fully back in the office by September. And we were probably sitting at about the 70% are back in the office already at this point in time.
That's great.
Yeah, and Stavros, I can offer as well just a bit of what I'm seeing. I think that I was going to mention government's back, so they seem to be taking the lead. But what we've seen is, obviously places like retail or people who need to sell to the public and need to be in their places of business to operate, are the ones most often back here. That's not a surprise. We don't see as many from the kind of professional services or the things like some of the school boards or some of the different agencies that don't have people coming into their offices, right? They perform an important function, but they don't necessarily interact directly with the public. So we see that they're a little bit more taking their time coming back, and some of the concerns that they have are some of the things that you mentioned, right? How can we get in the building? I can give you an example of the KPMG office in Regina. We're on the 20th floor, and our landlord has a limit of 2 people in any elevator at any time. So just even the challenges of trying to fill up a 20-floor building with no more than 8 people in the 4 elevators at a time. So that comes with challenges and productivity challenges. So I think that's what a lot of people are working through.
Yeah, that's great, and of course, Saskatchewan as a province has done better than most other provinces, right, in handling this, which I think has been really good. And yeah, I'm working with some clients, as you know, James, in Saskatchewan, and a lot of them are back. But I think the challenge is maybe organizations are back, but how high is the percentage of people being back, right? Obviously, more in public sector than other sectors. And here, I think the 10 to 25%, just to give a bit of context into it, that's not the number of companies. I think that would be a much higher number. It's just the number of workforce within those companies, just to clarify. Okay. Any other thoughts or comments from our participants on this? Okay, so we'll keep going then. And we are going to go now into our actual framework. So the framework that we've put together basically consists of considerations for returning to work across a number of different areas. And we've categorized this under three areas, or three stakeholder groups, I would say. So the first one is things that the task force, the governance, and the risk need to do or are responsible for. The second one is around your employees and your visitors, health and safety. And the third one is around the preparation of the workplace and the overall management of your workforce. So we under each one of these three categories, we have 23 categories of things, again, that organizations need to look at. And I'm not going to go through all of this in detail, but you can see here, what some of these things are. It could include things like looking at your at the health and government guidelines, for example. That's one thing, and looking whether your preparations align with those health and government guidelines. Looking at your insurance, or from an employee perspective, having like the right PPE in place, both for your employees and for your visitors to the workplace. And then from a workplace perspective, obviously there's the actual workplace redesign and improvement to enable that physical distancing. There's technology and security considerations as well. Cyber attacks have increased over the last period, just because everybody has been working from home, or a lot of people have, and again, you don't have the same precautions, or not all organizations have the same precautions for their employees working remotely. So those are some of the things that organizations would need to look at. Under each one of these 23 categories, there's a number of additional line items that we look at. So in total, we have a playbook, which we're not going to show you today, but if you're interested in finding out more about that playbook, happy to have a separate conversation with you and share with you some additional information. However, that playbook includes up to 400 line items. So that just gives you an indication of how many things organizations need to consider in bringing their employees safely back to the workplace. There's just a lot of things to consider. Obviously, not all of them are as critical. There's things that are really important in terms of the protective equipment, for example, in terms of the cleaning, the hygiene, this physical distancing, but again, also reviewing your policies and procedures, especially if you're having a hybrid environment where you allow some people to continue working from home and others working like from the office. For example, if you're bringing people back from temporary layoffs and things like that, there is employment law and occupational health and safety considerations that you have to look at. So that's the framework itself. And then in terms of the application of the framework, we look at this being applied over 4 cycles. So the first cycle is working through the framework and those 400 line items that I've mentioned, and understanding where you as an organization line up against those 400 items. Where could you potentially have some risks or challenges or issues that you have to mitigate? The second stage is creating that plan and actually starting to address those gaps prior to bringing your employees and your visitors back to the workplace, which is wave 3. And then wave 4 includes subsequent waves of return, because what we're seeing is not a big bang approach. Organizations are bringing their people back in waves, and not everybody at once, because they want to check that once they do bring people back, that they've brought them back safely, that things are working well, that there's no cases and everything runs smoothly before they can add additional workforce, back to the workplace. And this is a cycle. I mean, if there are future outbreaks of the disease, and we're hoping that it's going to be managed, but if there are, then again, you may need to send again some people potentially back home, or if there are outbreaks within your organization. So you need to be flexible in going through these different steps, not just one time, but potentially many times, or at least, many times for different groups of people. And, at the end of the day, it is around building a gradual and phased and safe return, a plan for a gradual, phased and safe return. And also listening and monitoring the guidance from the government and from the health authorities. Because, again, that could change over time, so it is very important to stay current with those guidelines and not to expose your organization to any unnecessary risks. And Kirk, I'm not sure here if you wanted to provide any insights around any tips for organizations in terms of how can they stay current with some of those guidelines. I know, as you said, they can be a bit high level, but obviously they cover, some important things. So I don't know if you wanted to chime in and contribute anything on this.
Thanks for the opportunity again. I think that what we have to do is ensure that we don't get ahead of people and we don't always listen to the rumor mill that's going on. We've seen and talked to a lot of businesses out there that, there's the general requirements that the Chief Medical Health Officer for Saskatchewan sets out in the Reopen Saskatchewan plan. And if we follow them, we don't have to do more. We have to do at least the minimum of what he's asking us to. But other than that, just keep checking in with what's being out there, what's being published by reputable operations and medical officers. And everything should be fine, right? The whole idea is that we work with safety in mind. And as you stated and put out, it is in the best interest of the public and the individuals themselves to be safe, to protect the public health system, and to ensure the economy continues to get going. And what everyone online is looking at is to operate a business, do what they do best, is make money and grow the economy. So the guidelines are out there. Follow the guidelines, and everyone should be safe. And it's, what we're looking and hoping that the economy gets rolling again.
Perfect. Thank you, Kirk. And in terms of some of the key mitigation measures from a health perspective that organizations can do, we've summarized those into 4. So the first one is around access control. So who has access, to the building or to the different floors among employees, visitors, or vendors, and whether you have any screening for employees and for visitors and everybody else accessing those different locations. So many companies have been doing that, and they've also been keeping logs so that they know who is moving where. And again, this is a temporary measure, but it's more to know if, in case there are cases, who else have they been in contact with, so that you can do that tracing in case there are any infection or cases within your organization. Physical distancing is pretty key as well in terms of 6 feet. So many organizations have been rearranging their workplaces, especially if they have open plans, to ensure that that takes place. The personal protective equipment as well. So, and we're seeing different things here with companies. A lot of them are offering this to their people. Others are asking their people to bring them to their workplace. Obviously they try to have some inventory to be able to provide, but again, because this is a high number, to the degree that you can ensure physical distancing, the people, at least in terms of using masks, they don't need to wear masks if the physical distancing is there. And then the workplace cleaning and the hygiene, that's pretty important too, and the frequency of that, to ensure that that happens on a daily basis, a number of times a day, and the virus, if it does come to the workplace, it's not allowed to spread. In terms of building the action plan, I've already talked about the playbook. That's the next step for many organizations. If you haven't started doing so already and you are considering it, if you do need more guidance or you have questions, please feel free to reach out to us. Before closing, I wanted to talk about some additional considerations with returning to the workplace, because there is the plan component around returning to the workplace and those different considerations and criteria that you have to go through. But this is also an opportunity, as I've mentioned before, to look at things that could be a bit more medium and long term, but start putting some of those measures in place from now to ensure that resiliency and to ensure that in case there is another outbreak or a future pandemic, then you're ready as an organization to address this without having to go through the same learnings that you had to go through previously. So what do we mean by that? There's a number of things, and there's a number of organizations that are just refusing to return, not to the workplace, but to the old ways of working. So this includes things like using more digital. So a lot of companies have introduced Microsoft Teams or Zoom or Google Hangouts, for example, ensuring that those platforms are continuing to be used and other digital platforms are being used. Even we've seen companies using digital platforms as well to reach out to their customers or clients, for example. So those are some benefits that have been brought up through this pandemic that organizations are looking to capitalize and sustain. The other ideas or things that organizations are doing, I've talked about, the continued work from home, ability for some of your people, and many organizations are putting work from home frameworks and policies right now to enable their people, in case they have those personal challenges, to be able to continue working from home. Or also they're using it also as a way to attract and retain like the younger generations of talent who are looking for that flexibility, and they who wouldn't want otherwise to be working for an organization that doesn't offer that. And now it's an opportunity to tap into those additional talent segments as well. It is also an opportunity to redefine, who you are as an organization and your value proposition, both in terms of your clients as well as in terms of your workforce. So there's a number of things here. Other organizations are looking at their poverty footprint. They were looking to expand that footprint. Some now are considering like whether they need to do that or not, and whether maybe they keep the same footprint and the same buildings that they currently have, and then maybe enabling some of that remote work on a more sustainable basis. And we'll share this deck with you later on. So after this call, so you can have a look at some of these examples. So again, looking ahead for this new reality, here's the considerations, and these are the same things that I've just talked about. Is there an opportunity to go to kind of a hybrid environment where some organizations offer some of their services online? Is there a way to continue promoting productivity and creativity by allowing some remote work and by enabling the use of these online technologies for online meetings. Before, we only used to have conference calls. Now almost everybody has like video calls. So how do we sustain that? Mental health is an important consideration as well, and especially for people that are working long term from home. So again, have a look at that and put some measures in place to protect and support your workforce. In terms of investment areas, those could include things like digital applications. It could include upskilling some of your managers or leaders in terms of being able to manage teams that may be working in different ways, both in terms of whether they're working in the office or remotely, but also just different type of challenges that they may be facing, such as, in their personal life or mental health or whatever. So managers, we've seen, like, they don't always have those skills. Obviously, they haven't had to manage something like this before or lead teams through something like this before. There's a big amount of stress among people right now. So it is important to enable your managers to be able to, to lead their teams through this, not just through this period, but also, more longer term. And those are some of the main things that organizations are looking to invest in. And with that, we wanted to open it up for questions.
So Stavros, we have a question that came through the text chat that I can pose. I'm going to break it down a little bit. Mm-hmm. And, there might be some of this that's kind of leading practice, but some of it might be more of a, kind of a legal question in the Saskatchewan environment. So not sure if Kirk might know the answer to some of these, but so it really is around to guidance for when employees are coming back to work and how they're feeling about it. So the first question is, if employees are uncomfortable with coming back to work, what should be done in this situation? And, should you force people to come back to the office if it's possible for them to work from home?
Yeah, this is a legal question, and I've heard this question before a number of times. So I'm just going to recite what I've heard from our employment lawyer. However, I'm not a lawyer myself, so I would suggest, obviously, you didn't need legal advice to talk to your legal counsel, but organizations have a responsibility to listen to their employees, especially when they're raising concerns around returning to work. And those concerns could be legitimate, or maybe they're not legitimate, but you have to listen to those concerns. If you don't listen to those concerns and you bring people back without taking any mitigating actions, then you could be potentially sued in the future, especially if people decide to quit because of that, like for constructive dismissal. So what organizations can do is listen to their employees and then show that they've taken the right mitigation measures. And then if they've taken the right mitigation measures in terms of putting like all the health precautions in place, the physical distancing, PPE, all of that, then obviously employees will not have a solid foundation to be able to say they cannot come back. And then, the ball is on the side of the employer, let's say. So Kirk, I'm not sure again on this. It is a legal issue. I don't know if you want to add anything to this.
No, you're absolutely right. They should talk to the legal counsel. Just be aware that we are currently still under an emergency health order, and it does change things a little bit. So depending on the timing of this complaint or when it's brought up, you'll want to talk to your legal counsel about that. As well as all businesses must have a workplace illness policy, and if they do not currently have one, they should contact Occupational Health and Safety. That will help them walk through creating one that would take into consideration almost everything you said. But I think overall, what I think every employer should do is talk to their staff about how it is safe and what they are doing to create a safe work environment.
Exactly. Yeah.
Yeah, I think we've all heard some concerns, whether anecdotal or some legitimate, of people, who just would rather work from home and use this as a reason to try and achieve that because it's what they would prefer. So, I think it can be tricky to navigate. I mean, one of the first things I always do when someone asks for an accommodation is, simply ask why, right? And so that you can then navigate with the facts, as opposed to, making assumptions about it, because assumptions about why someone is concerned about coming back to work can be troublesome as well. So the second part of that question is around, employees calling in sick. I've certainly seen lots in the media about this. And it's about what is, do we have any suggestions on guidance? Like, if people think they're having symptoms, if they've went and got a COVID test that can take a number of days to get back, what needs to happen with employees? And part of this, I think, is again a bit of a legal question, depending on what any sort of union requirements might be, or Saskatchewan labor law that I'm not an expert in. But it's, do they have to take sick time, or are you obligated to give them kind of any time off? So have you navigated that much before, Stavros?
And for Saskatchewan, I can't talk, but different jurisdictions have different regulations on this. So if they are sick, at least in Alberta, I know that they are allowed. They have to work. First of all, they have to self-isolate for 14 days, and then they will continue to be employed and paid during that time. That's by law. Again, I don't know what applies in Saskatchewan, but I was going to approach it a little bit different here and just share what I'm seeing in terms of when there are some of those symptoms. And I understand in many cases, like, employees might just, not want to go to work. Maybe they don't really have, real symptoms, right? But at the end of the day, there is abundance of caution. Generally, from what I've seen. So if somebody has a sore throat and we're not sure whether this is COVID or somebody else, let them work from home until at least, the symptoms are not there. So that's the guidance that I've been seeing, like, from many organizations. But again, I'm not touching on the legal component. That's separate. You should talk to your legal counsel about that specific aspect.
If I could just jump in on that one quickly. In Saskatchewan, tests are available for all workers right now. So you call the 188 or 811 number for the government of Saskatchewan, do the online testing tool, register for a test. You should stay home. The Chief Medical Health Officer has indicated that if you go home with symptoms of COVID-19, you should stay home while you're getting the test, take the test, and get the results before you return back to work.
That makes perfect sense. Thank you, Kirk. Any other questions?
I'm sorry, James. It looks like you're talking, but you're on mute, so we could just hear your mouth move.
Yeah, I was. So I think the question, if it does come down, and we've heard these before, right? Where if you think that someone isn't sick, or if they have shown negative, but they still are not coming to work because they're sick, I think that really does become a legal question that you need some employment law answers for, and that we're not really we really don't have all those answers. Okay. Mm-hmm. So there wasn't any other questions that came through the text chat. We have some time. We wanted to open up. Does anyone want to unmute and ask any other questions that you have? We are at your disposal for the next while to help as we can. Okay. Well, we have a bit of a shy group. I certainly hope that there's not a bunch of questions, because we've given you some really good information. But as Stavros has said, if you had a couple other questions that came up later, our contact information is in the the deck, and as well as Kirk's identified. I mean, there are a number of official guidance that we can refer to, the opening plan, the public health orders, and just paying attention to what's coming out from Dr. Shahab and SHA around specific guidelines or rules to watch out for. Other than that, I think we all have to proceed and operate our businesses as best we can and try and navigate this tricky situation. So just going to give just another 10 seconds to see if there's any other questions before we give you some time back in your day.
I have a question.
Please.
So when we are bringing back our clients for programs, is it a good idea or is it necessary to have some sort of a waiver, saying that we've provided proper PPE and we're following the guidelines, but that they are still choosing to attend such an activity? Is that something to consider?
Yes, we've seen that. We've seen that with some organizations doing that. It is a good idea. We do it, James, as well. Within KPMG too. So yeah, so it is a good idea for sure.
Okay.
But again, sorry, I was just gonna say, James, in terms of the language in that waiver, again, you have to take advice from your lawyers. I understand that not all organizations are big enough, to have access to lawyers. I think that makes sense, and I've seen that comment there. However, it is important for things like that are quite sensitive, to get that advice.
Yeah, well, we've seen a few more things come through on the text chat. And in terms of, it might not be a waiver per se, but I know that some businesses are requiring people to, fill out on a daily basis, even in some cases, that they're not experiencing symptoms, they haven't traveled, they haven't been near people known to have COVID. My wife works for the health region, and she has to sign that every single day before she goes to work. So there are, organizations that are requiring people to, effectively assert that they're well before coming to work, or at least that they're not aware that they're potentially having any symptoms. That may be more to kind of, a bit of a move to cover the employer in the case that someone turned out to be sick. They're showing that they've done all they can, but nonetheless, that's what organizations are doing. I think that there's been a question of, do we have any sort of kind of form that could inform what such a waiver, could look like? So Stavros, that's something maybe you and I can take away. And there was a comment here. It's not really a question, but more of a comment, and I think several employers are feeling it. A comment about how the CERB is maybe affecting employers and kind of motivating employees not to come back, because some of them can maybe make as much or enough on the CERB that they'd rather do that than come back to work. So I'm not sure we have much to say specifically about what you do with that. That's different from our comments before about having employees come back to work, other than to say that we have heard that as a bit of a common concern, more anecdotally, I would say, than seeing that as a real barrier for people to come back to work. So we haven't seen anything else come through on the text chat. So last time when we almost said we were done, we got a flurry of activity. So let's give one more call for any other thoughts or questions.
James and Stavros, if I could jump in as a closing comments and seeing if we can get some more questions here. If anyone would like more information on the guidelines, or to talk about the guidelines, or have just to see what's going on and where we're currently at, there is the Support for Business line with a toll-free number at 1-844-800-8688. Or you could email supportforbusiness@gov.sk.ca. We have a line of people that are willing to help out and answer any questions we can on the Reopen Saskatchewan plan.
Did you give that number one more time, Kirk?
Yes, 1-844-800-8688.
Great. I typed that into the text chat just so if people want to note it. Okay.
Thank you.
Great.
I have a question about that.
Please.
This is Bobby. I'm the role coordinator at Stacia. On that business line, can you offer legal advice for those organizations that maybe don't have access to it?
No, we cannot offer legal advice. It's just on information on the Reopen Saskatchewan plan. But if you are looking for information on labor standards and workplace safety, they can help you out with all those questions as well.
Oh, they can point you in the right direction?
They can, yeah. Or talk to these guys at KPMG that do a fantastic job.
Do either of you have any suggestions on who people could talk to if they need legal support?
Well, I think that we have got some kind of frequently asked question material that may cover off some questions. I mean, again, at KPMG we're not a law firm, so we do have to be careful of giving specific legal advice. But but depending on the nature of the questions, we sometimes have got some answers that we're pretty comfortable with.
And James, maybe you're not aware of this. We do have a couple of employment lawyers within KPMG that offer advice to clients, and they can. They're registered to be able to offer advice in Saskatchewan as well. So we do have that. You don't need to come to KPMG, but if you do, we do have those individuals, and they're great. I've worked with them on a few engagements, and they're very knowledgeable.
Thank you for that.
Yeah.
Okay. Well, I guess, Stavros, any closing questions?
No, I just wanted to thank you for the opportunity. So both Ahmad and you, James, for the opportunity, and I think it was a good session. So yeah, if you have any more questions or need any additional information, happy to help. And James will be sending the deck as well to everyone, right?
Yeah, we have a recording of the session as well in case there's others in your group that weren't able to attend. So thank you very much, Stavros, for taking some time to do this, and thanks a lot to Kirk as well. Kirk's been working tirelessly with his group for literally months since the mid part of May or mid part of March, trying to get the recovery effort planned and work through these questions. So really do appreciate you taking the time out of your busy schedule. So thanks very much, everyone, and wish you a great rest of your day.
Awesome. Thank you.
Thank you, everybody. Take care.
Bye.